Welcome to this explainer. Today we're tackling something that affects just a massive number of people, yet it's kind of always swept under the rug. We're talking about sleep apnea. For decades, we've treated loud snoring as, well, just a simple nighttime annoyance, right? A punchline in a sitcom, or maybe just a really big nuisance for whoever's sharing the bed. But the latest medical data? It's telling us a totally different story. It's actually a critical, systemic health issue. And today, we're going to unmask exactly what's happening to your body while you sleep.
Okay, let's dive into this, because this is where the science gets truly fascinating and, frankly, a little terrifying. What if your loud snoring is actually damaging your brain, like structurally changing it? Medical research, including some really eye-opening data from neurology experts at Nebraska Medicine, has revealed a direct link between untreated sleep apnea and long-term cognitive decline. We're talking dementia and Alzheimer's disease. So we aren't just looking at being a little groggy the next day. We're talking about physiological changes to your brain over time. But hey, don't worry, we aren't just here to deliver doom and gloom today.
Here's what we're going to cover: the hidden brain threat, obstructive versus central apnea, recognizing the warning signs, modern treatments, and some seriously breakthrough nerve therapies.
Section 1. The hidden brain threat.
So to understand this physiological mystery, like how interrupted sleep secretly wreaks havoc on your long-term cognitive health, we kind of have to understand what a normal brain does at night. When you hit deep sleep, your brain essentially turns on its own nocturnal wash cycle. It's literally flushing out waste products, including these abnormal proteins that are heavily linked to Alzheimer's disease. But when you have sleep apnea, your airway collapses, your brain panics from the lack of oxygen, and it briefly wakes you up. Boom, wash cycle interrupted. And because that cleaning system never gets to finish its job, those harmful Alzheimer's-linked proteins, they're just left there to build up in the brain over years, even decades.
Now, what's really interesting about this slide is that the damage isn't just about waste buildup. Those repeated drops in oxygen physically injure your brain cells, especially right in the areas responsible for memory. Plus, this oxygen deprivation actually damages the small blood vessels in your brain, leading to these tiny areas of reduced blood flow. So the symptoms of this physical damage, trouble focusing, mental fog, memory loss, they can look exactly like early dementia. But here's the absolute game changer. Unlike permanent dementia, if you catch this early and treat the apnea, these cognitive symptoms can actually often be reversed.
Section 2. Obstructive versus central apnea.
Look, not all sleep apnea is created equal, right? And understanding the biological mechanics is absolutely crucial to finding the right fix. But before we break down the different types, just consider the staggering scale of this problem: 1 billion. According to global health data, nearly 1 billion people globally are affected by obstructive sleep apnea. That's a true global health crisis just hiding in plain sight right in our bedrooms.
So, what are the types? First up, we have obstructive sleep apnea, or OSA. Now think of this as a plumbing problem. Your brain is desperately trying to breathe, but there's a physical blockage because the muscles in the back of your throat relax too much and just collapse inward. Conversely, we have central sleep apnea, or CSA. This one is way rarer in the general population, and it's more of a wiring problem. There's no physical blockage at all. Instead, it's a neurological failure where your brain simply forgets to send the electrical signal down to your diaphragm and lungs to actually take a breath.
But here's the thing. Within specific high-risk groups, central sleep apnea is astonishingly prevalent. While it's rare in the general public, if you look at patients suffering from heart failure combined with atrial fibrillation, which is an irregular heartbeat, a massive 80% of them have central sleep apnea. 80%! It creates this awful vicious cycle, right? A weak heart leads to central apnea, and then the central apnea starves that already weak heart of oxygen, which just makes the cardiovascular disease even worse.
Section 3. Recognizing the warning signs. Now that we know what's happening under the hood, I want to empower you to spot these hidden dangers in yourself or maybe your partner. Let's actually do a mini interactive exercise right now using the Stop Bang checklist. It's one of the most widely accepted screening tools doctors use. Let's mentally score your risk. Ready? Do you snore loudly? Are you often tired during the day? Has anyone observed you stop breathing in your sleep? Do you have high blood pressure? Is your BMI over 35? Are you over age 50? Is your neck circumference greater than 40 centimeters? And finally, are you male? If you just answered yes to 5 or more of those, well, clinical data suggests you're at a high risk for moderate to severe obstructive sleep apnea.
But wait, how do we separate just being regular tired from working too hard, from dangerous clinical sleepiness? Well, doctors use the Epworth Sleepiness Scale. It's a really cool quantitative tool that asks you to rate your likelihood of dozing off in everyday, totally normal situations, like sitting and reading or watching TV. A score above 9 scientifically indicates excessive daytime sleepiness, and that definitely warrants a proper medical assessment, like a home sleep test or an in-lab sleep study.
Section 4. Modern treatments and alternatives.
Okay, so let's say you've been diagnosed. What next? Well, welcome to the hope phase of our explainer. When we compare traditional treatments for obstructive sleep apnea, the CPAP machine is sitting right at the top. It uses continuous air pressure to act as this sort of invisible pneumatic splint holding your airway open. It is the gold standard, and it is highly effective. But here's the harsh reality. Compliance is incredibly tough. Nearly 50% of patients just quit using it in the very first month. No way, right? So for those who can't tolerate a CPAP, we have oral appliances. They kind of look like custom mouthguards that gently pull your lower jaw forward to open the airway. And finally, for severe anatomical blockages, there are surgical options like UPP or MMA, which physically remove tissue or structurally alter the jawbone.
Now, before we get to the really futuristic stuff, I just want to briefly remind you that foundational lifestyle changes are incredibly powerful. Things like modest weight loss, cutting out alcohol and sedatives right before bed, and using positional therapy, like those clever little devices that literally force you to sleep on your side rather than your back, they can significantly reduce the severity of your apnea without you needing a single wire or machine.
Section 5. Breakthrough nerve therapies.
But what if CPAP fails, and those lifestyle changes just aren't cutting it? Well, this is where medical science starts to sound a bit like science fiction, and it is absolutely awe-inspiring. First up for obstructive sleep apnea is hypoglossal nerve stimulation, or HNS. Think of this as a pacemaker, but for your tongue. It's this tiny implantable device that actually monitors your breathing while you sleep. Right when you suffer an apnea, it sends a super mild electrical pulse to your hypoglossal nerve. That's the nerve that controls your tongue. This pulse causes the tongue to just gently push forward, instantly opening the airway back up. Clinical trials show this can reduce apnea events by a massive 68% at 12 months for folks who simply can't handle a CPAP machine.
Now, what about central sleep apnea? You know, that wiring problem where the brain forgets to breathe. For that, we have transvenous phrenic nerve stimulation, also known as the REMEDY system. This one is implanted just like a regular cardiac pacemaker, usually by a cardiologist. But instead of pacing the heart, it stimulates the phrenic nerve to tell your diaphragm to just breathe naturally. It automatically stabilizes your carbon dioxide levels all night long, and crucially, especially for heart failure patients, it does all of this without pumping forced air into your lungs. That means it doesn't increase pressure inside your chest, which, as we know, can be really dangerous for a weak heart.
And this technology? It translates into massive, real-world clinical proof. In pivotal trials for phrenic nerve stimulation, patients went from a terrifying baseline of 45 dangerous sleep events per hour all the way down to just 20 events per hour after 6 months of treatment. And those central apnea events, they were virtually eliminated. Patients reported massive, life-changing improvements in their quality of life, their daytime sleepiness, and their overall health. It's this brilliant physiological approach that essentially restores normal breathing from the inside out. So, as we wrap up, I want to tie this entire explainer back together with a really powerful quote from neurologist Dr. Daniel Merman. He said, "Treating sleep apnea offers benefits now and may help protect brain health in the future." That really hits the nail on the head, doesn't it? Treating apnea isn't just about fixing a noisy night so your partner can finally get some sleep. It's about profound, long-term protection for your heart and your brain. It's literally about preserving your memories, your focus, and your cardiovascular health for decades to come.
Which leaves us with this final thought. If a better night's sleep, facilitated by everything from simple side sleeping all the way to a sci-fi pacemaker for your diaphragm, could protect your brain from dementia and save your heart from failure, isn't it time you stopped ignoring the snore? I highly encourage you to look at those warning signs, have a chat with your doctor, and take control of your sleep. Thanks so much for joining me for this explainer, and hey, here's to a healthier, much more restful night ahead.